I'm Brian Tucker, Chief Digital Officer at Televero Behavioral Health. Our corporate headquarters is in Austin, Texas. We are currently in 22 states. We'll be in 40 by the end of the year. I think one of the things that stood out to me the most with AIR Pro was the ability to just completely obsolete the need to connect to a system of record. You don't have to use AI to figure out how to use AI. It's very intuitive when you go into the platform on how you need to set this up and how you need to configure it. It actually will help you configure itself, which takes the learning curve out of it. And I think the faster that you can get something like this turned on with the least amount of friction in the process, the faster you're going to be able to learn what you need to adjust and pivot to be able to get the outcomes that you want. This is moving at lightning speed. The thing that really was a jaw dropper for me was the ability to see a product in a buy versus build model where we could actually turn these agents on in a day, multiple agents on in a day, and put them to work for us and be able to scale our workforce up. If I were to put AIR Pro in today, I think the first problem that I would solve with that is calling patients back after a late cancel or a no-show appointment. The number one indicator of a patient who is going to lapse and not come back to care is their last appointment was a late cancel or a no-show, and or they had an appointment and they didn't pay their late cancel no-show fee, right? So we've got to get back in touch with those patients and find out what's going on with them and get them back on the books as soon as possible. So having an agent that can be able to do that, gather the feedback, and actually have a human in the loop that they can do a warm handoff to is going to make a major difference in keeping them in treatment where they need to be, particularly if they're on medication. It's super, super important.